All right, peace and power elevation be to all you people out there. This your girl Tiffany here, live in effect. Tonight's topic, I will be going into the information about an organization that primarily focus on Black women's health. Also, not just health as far as disease is concerned, or any of that, but also the reproductive health rights. So I want to go into that. And also, I want to talk about the founder of this organization. Her name is Byllye Avery. So she was the founder. Now, it's very interesting that many people may not, many people have not heard about this, except for those that probably are very active in social activism, or that volunteers in the healthcare field or whatnot. But most of the time, you don't hear about organization that primarily focuses on the health of African American people, and particularly women at that. So I just decided tonight I wanted to talk about this. So, regardless of what my views are and how I may feel about certain things pertaining to this organization, that's not going to interfere with the historical facts and historical information that's on here. So, I just want to go ahead and go into that detail, and I want to share this information. Then I also want to talk about the founder, and I want to share the website where it can be found. So I want to go ahead and get started. So, Black Women's Health Imperative. Black Women's Health Imperative, previously the National Black Women's Health Project, which was formed in 1984 in Atlanta, Georgia, out of a need to address health and reproductive rights of African American women. Okay, so the National Black Women Health Project was principally founded by Byllye Avery. Avery was involved in reproductive health care work in Gainesville, Florida in the 1970s, and was particularly influenced by the impact that policy had on women of color and poor women. Additionally, Avery was also concerned with the healthcare choices and wanted to provide an environment where women could feel comfortable and take control of their own health. Lily Allen, a healthcare educator, was primarily concerned with birthing choices of African Americans as well as internalized racism within the community. Both women worked with the National Women's Health Network and started the project within the organization. Eventually, they abstracted the project from the NWHN because of concern regarding the lack of focus on the issues facing Black women and poor women, which played out through the events that occurred during and the National Conference on Black Women's Health Issue at Spelman College in 1983. Because of the two main focuses on self-help and the medical establishment as an institution, the NBWHP and flows between a grassroots operation that focuses on the community of women and one that focuses on policy. By 1987, the National Black Women's Health Project were headquartered in Atlanta, Georgia, and housed offices in Brooklyn, New York, and the Bay Area of California. The New York City office was directed by Gwen Braxton. The National Black Women's Health Project later opened an office in Washington, D.C. to address policy issues and moved their headquarters to Washington, D.C. NBWHP has changed their name to the Black Women's Health Imperatives. All right, so going down to the United States health statistics. African American women's health in the United States is continuously shown to be far worse than that of any other group of women in any other racial or ethnic group. Currently, African American women have higher rates of morbidity regarding health issues like obesity, diabetes, and adverse birth outcomes. African American women are also more likely to die from certain cancers, cardiovascular disease, HIV, and AIDS. There are many different factors intertwined within our society that contribute to these health disparities, many of which reflect on the effects of experienced racism on day-to-day lives. And you know what, this has become a serious issue, especially within the hospitals. When women go to the hospital and give birth, whatnot, you see there is a lot of disparity going on, particularly with African American women. They're not really getting the proper care, or they're not able to afford to pay for going through the process of childbirth, because that has to be paid for. That's something, yeah, you gotta pay for it. And sometimes the health care or the health insurance that we receive may not cover every single thing, may not cover all our all the things that is needed as far as like surgery is concerned, or what, like if you had C-section, or if you had the epidural shots, or whatever the case may be. So yeah, so the health insurance does not always cover every single thing. So yeah, it's been a serious crisis as far as the healthcare industry is concerned, and how they pretty much treat Black women when it comes down to childbirth. But let's go ahead and continue. So now, down here it says some factors that contribute to the health disparity within the community of African American women in the U.S. are related to one's social demographic status, sexual orientation, geographic location, and age. Research has shown that income and higher education are strongly correlated to one's overall health, along with showing that African American women who make a higher income experience improved cardiovascular health. Education has also been found to be strongly correlated with improved health outcomes within African American women. This reflects the idea that there are three levels of racism that continue to affect one's physical health. These levels consist of institutionalized racism, personally medicated racism, and internalized racism. These levels of racism have a direct contribution to women's health, as it was found that foreign-born mothers were more likely to be older, married, and better educated. Foreign-born women were also shown to have better pre-pregnancy weight, along with having higher rates of prenatal care than those born in the United States. It was also found that foreign-born mothers were less likely to give birth prematurely. Many of these health issues stem from the fact that African American women are less likely than a white woman to receive many of the needed health services, including routine preventative care. In the past 5 decades, African American women have experienced at risk that is 4 times greater regarding death from pregnancy complications than a white woman. 4 out of 5 African American women are considered to be overweight or obese. 1 in 4 African American women aged 55 and up are affected by diabetes, making them almost 2 times more likely to have diabetes than white women. It was also discovered that statistically, white women reported receiving more prenatal advice on alcohol, smoking, and the importance of breastfeeding than African American women. And that is not so surprising to me. African American women were also found to be 23 times more likely to die from pre-existing health issues like pre-eclampsia or eclampsia, aprucio placentae, placenta previa, and postpartum hemorrhage than white women. Wow. African American women reportedly have significantly less trust in their own physician due to past experiences in our healthcare system. It was also shown that African American women have higher levels of trust in informal health informational sources, some which may not be factually based. And then going down here, it says the aims. So the aims, the Project's 5 health imperatives for Black women are make Black women's health an imperative for federal and state governments and communities. Work to eliminate the health disparity that exists for Black women. Ensure that Black women have access to reproductive health options, are empowered to make real choices, and are ensured of privacy in reproductive decision making. Reduce the high death rates among Black women from preventative causes. Increase access to health insurance coverage for Black women and their families. So it goes down to talk about the contribution. National Black Women's Health Project initiated projects that were geared towards the totality of women's health in addition to reproductive health care. The projects included Walking for Wellness that featured Wilma Rudolph to encourage African American women to improve their health through exercise. Additional programs included education about birth controls option, as well as a video to encourage women to look at their vaginas through self-examination. On their website, there are resources regarding healthcare issues as well choices. The NBWHP published the book Body and Soul, a Black Women's Guide to Health and Well-Being by Linda Valrosa, in Our Bodies, Our Voices, Our Choices, which serves as Black women's primer on reproductive health and rights. Controversies. During the 1992 March for Women's Lives, there was conflict in the planning of the march between NOW, which is the National Organization for Women, and smaller feminist groups of color. The protest was headed by Byllye Avery because of the continuation of issues concerning race and representation. While organizations eventually were asked to speak, many stood in solidarity with Avery because she was the first woman of color to come forward publicly and nationally for reproductive rights. All right, so that's that information. Here's the reference at the bottom of the page, and here's the external links. All right. So I also want to show the website. Okay. Let me show you guys the website. All right, so this is the website is bwhi.org. It's called Black Women's Health Imperative. All right, so as you can see, according to the website, it says it's been around since 1983. So this is Dorothy Height right here. Okay. So if you want to find out more information, you can come on this website. All right, so this is the website. So basically, there's great benefits to this organization. So basically, the primary focus is on African American women's health and teaching women the importance of taking care of themselves, how to maintain good health, get them access to the best quality physicians, clinics, also making sure that they're able to get the best quality healthcare insurance. Because again, a lot of places, a lot of insurance companies, for one, they're very high. I'm gonna be honest. These insurance companies, they high as hell, for one. And then for two, they not, and then they want you to pay all this money, but they don't cover everything. They do not cover everything, especially if you have certain type of disease. These insurance companies would not cover them. So now you're stuck. You're screwed. You're fucked up. So you have to find, well, which one will be better qualified? which one would be more accessible, which one is a lot more cheaper. So that's one reason why these organizations came about, because there's a lot of health disparity, racism, and a lot of people in the inner city community cannot afford to get certain insurance, especially where they working at a job that doesn't pay enough money or doesn't pay enough as far as wages are concerned. So livable wages at that. So it's very hard to get access to insurance these days, especially healthcare insurance. It's very hard. All right. So, but I want to go into a little bit about Byllye Avery. Okay. All right. So right here, Byllye Avery was born Byllye LaVon Avery on October 20th of 1937, and she's an American healthcare activist, a proponent of reproductive justice. Avery has worked to develop healthcare services and education that address Black women's mental and physical health stressors. All right, she is the founder of the National Black Women's Health Project, which is the first national organization to specialize in Black women's reproductive health issues. For her work with the NBWHP, she has received the MacArthur Foundation's Fellowship for Social Contribution and the Gestahl O. Linhart Award for Advancement of Healthcare from the Institute of Medicine of the National Academy of Science, among other awards. Avery was born in Waynesville, Georgia, and grew up on a farm in DeLand, Florida. She is the daughter of L. Elise M. Ingram, a school teacher. Her mother graduated of Bethune-Cookman College. Her father, Quitman Reddick, owned a neighborhood store. He was killed when Avery was 14 years old. The oldest of three children, Avery assumed a lot of responsibility from a young age. Avery attended college at Talladega College and earned her BA in psychology in 1959. She met her husband, Wesley Avery, while at Talladega College, and they married in 1960. In 1967, Avery received a fellowship to obtain her master's in special education at the University of Florida, Gainesville. Upon earning her MED in 1969, she became a special education teacher. In 1970, only a few months after starting her new position, her husband suffered a fatal heart attack. He was only 33 years old, and it was discovered after his death that he had very high blood pressure. At the time, she was also pregnant with their third child. The death of her husband helped catalyze Avery's commitment to improve healthcare and health education in the Black community. So that was one of the reasons why she got involved into doing healthcare and became active because of her husband's death. He had died from a heart attack. And Avery met her wife, Gina Lithcott, in 1989, and the two were married in 2005. Lithcott is a public health practitioner and activist. Activism in the early 1970s, Avery began participating in consciousness raising group and legal abortion referral services in response to the lack of access to abortion and other reproductive health needs that low-income Black women face in their community. Avery and her colleagues, John Ellison, Judy Levy, and Margaret Parrish, opened the Gainesville Women's Health Center in 1974. It was the first abortion and gynecological care clinic in the city. They opened these facilities after a petition to open a Planned Parenthood clinic in Gainesville was denied. The GWHC mission statement was to help women solve the crisis producing situation of unplanned, unwanted pregnancy at a low cost. The clinic provided abortions and contraceptive services, facilitated sexuality workshop, and provided other women's health related training and services tailored to Black women, such as sickle cell anemia testing. To help educate women on best health services, the staff created a monthly newsletter called Sage Feminine. In 1978, Avery helped to found Birthplace, an alternative birthing center in Gainesville. Certified nurse midwives assist women with deliveries, and Avery personally assisted in the birth of 100 patients before her departure. In 1981, while serving on the board of directors for National Women's Health Network, Avery started a 2-year-long project called the Black Women's Health Project. As part of this project, Avery planned the Conference of Black Women's Health Issues, which was held at Spelman College in June of 1983. 2,000 women attended the 3-day event. Topics included domestic violence, diabetes, sexual abuse, obesity, sexuality, childbirth, mental health, as well as holistic wellness. It encouraged attendees to take charge of their health through consciousness, raising community organizing around health issues and self-examination. Following the conference, Avery founded National Black Women's Health Project, now known as the Black Women's Health Imperative, officially in 1984 in Atlanta, Georgia. It is the only national organization exclusively dedicated to improving health and wellness among Black women. NBWHP opened an advocacy and policy office in Washington, D.C. in 1991. By 1991, the NBWHP had chapters in 25 states and had expanded its reach to work with women in Belize, Jamaica, South Africa, Nigeria, and Brazil. Recalling the negative attitude she was taught about sex as a child, Avery taught her daughters to celebrate their bodies and menstruation. When her first daughter turned 11, Avery gave her a cake that read, "Happy birthday, happy menstruation." That's weird. Soon after, she gave a workshop on menstruation and childbearing at her daughter's elementary school that she developed into a film on becoming a woman, mothers and daughters talking to each other. In 1987, the first documentary film by African American women sharing their perspective on menstruation, sex, and love. Along with proponent African Americans leaders such as Shirley Chisholm, Maxine Warner, Dorothy Height, Faye Waddleton, issued and signed a public statement, "We Remember African American Women for Reproductive Freedom," in 1989. The statement supports reproductive freedom, including the right to have children, the right to access to contraceptive services and reproductive health information, and the right to health care as well as safe and legal abortions. The statement connected racism, poverty, and violence to negative reproductive health outcomes for African American women. The statement was reprinted repeatedly and eventually circulated over 250,000 copies. The statement can still be found in many anthologies on women's rights and activism. Avery was awarded a MacArthur Fellowship this same year in the area of health policy. In 1990, Avery, along with 15 other African American women and men, formed the African American Women for Reproductive Freedom. The organization was created to end the stigma against abortion in the Black community and to make abortion more accessible for Black women. Avery has written and lectured widely on how race, class, and sex impacts women's health care. She has called the health discrepancies between African American and white women a conspiracy of silence. She has been a visiting fellow at the Harvard University School of Public Health. She has served on the Charter Advisory Committee for the Office of Research on Women's Health of the National Institute of Health. She has been a health issues advisor for the Catalog Foundation International Leadership Program, and she has served as a consultant on women's healthcare in Latin America, the Caribbean, and Africa. Now, these are the awards that she has received: the MacArthur Foundation Fellowship for Social Contribution in '89, Essence Award for Community Service, 1994, Academy of Science Institute of Medicine, Jiftal Linhart Award for the Advancement of Healthcare. 1994, Grassroots Realist Award by the Georgia Legislative Black Caucus. 1995, Dorothy Height Lifetime Achievement Award. 1995, President Citation of the American Public Health Association. 1998, Business and Professional Women's New Horizons Award. 2008, Ruth Bader Ginsburg Impact Award from the Chicago Foundation for Women. 2010, Audre Lorde Spirit of Fire Award from the Fenway Health Center. And these are the selected bibliography. And these are the references at the bottom of the page. And these are the external links. So you can go on here to Wikipedia if you want to find out more information. Okay. All right. Then she also written the page, which is Who Does the Work of Public Health? Okay, so I want to show you what she looks like. This is Miss Byllye Avery right here. This is her. That's her image. All right, so I just want to read something on here. It says, frequently we take the public out of public health and allow the practice to become extremely narrow, limiting to experts telling the public what's best for them. All right. So this was written in 2002. It took the death of a person I love and thought was healthy to turn my attention to the issue of health. So in 1970, my husband, 10 years, suffered a massive heart attack and died. The shock of this traumatic event on my life at the age of 33 has had a lasting effect on my own health and contribute to my resolve to help others through health education. In my numbness, I started looking for a place to talk about what happened and discuss how I could ensure that it didn't happen to others. In the midst of my despair, I came to understand that our health is most important assets. Knowledge of how to take care of ourselves is key. I turned to women's health and along with several other women in Gainesville, Florida, co-founded a women's health center and a freestanding birth center. Together, we developed women health services sensitive to the needs of women, including demystifying medical care and encouraging women to actively participate in their own health care. Many community-based organizations arise out of personal experiences, and they are often the ones that have fingers on the pulse of the people. A number of them have dramatically changed our nation's thinking on issues. And thanks to the feminist movement, women have been the catalyst for many of these important groundbreaking community-based organizations. In very profound ways, the second wave of feminism in its questioning of women's relationship to themselves, men, family, work, and health allow women to politicize personal issues and to organize around them. For example, Mothers Against Drunk Driving was founded in 1979 by a woman whose 5-year-old daughter became a quadriplegic after an accident with a drunk driver traveling at 120 miles per hour. That organization has changed our nation's perspective on drunk driving and saved thousands of lives. The Susan G. Komen Breast Cancer Foundation arose out of Nancy Brinker's commitment to her sister's struggle with breast cancer. Organizations like these were deeply influenced by the women's health movement in itself as a in itself a child of the women's movement of the 1970s. So abortion became legalized all over the United States, starting establishing women's health care centers that provide abortion and women gynecologic services. They created child birthing centers staffed by certified and lay midwives. Other community-based organizations focus on healthcare publication for women, such as the Boston Women's Health Book Collective pioneering book Our Bodies, Ourselves. The women who formed the National Women's Health Network honed in on the birth control pill and challenged its efficacy and high hormonal levels. The Committee to End Sterilization Abuse questioned the numbers of Puerto Rican and Black women, many in their 20s, who were being sterilized. Too often we forget that organizations like these, even in their infancies, do the work of public health. Frequently, we take the public out of public health and allow the practice to become extremely narrow, limited to experts telling the public what's best for them. But in reality, there are not enough public health educators to treat and teach the public. This means that the public must participate in a much more active way. And though it is rarely acknowledged that it is exactly what is happening. In almost every major city, women organized community-based organization provide a place for dialogue, education, organizing others, and making demands of the healthcare system. Their efforts to be active participants in their own healthcare include insisting on access to health records and information about contradictions of medicine, or was it constrandiations of medicine? Who then does the work of public health? We all do. All right, so how I learned the meaning of public health. So she goes into details at the Gainesville Women's Health Center, birthplace. We did our best to provide pregnant women who care with care that address not just the pregnancy, but all parts of their lives. We understood that pregnant women need prenatal caring, a system that helps them feel loved, respected, and empowered to take care of themselves and their family. In addition, we need to be actively involved in their health care and treated with respect. All right. So it's a lot of information here. All right. So as you can see, these are the three women. There's Byllye Avery in the middle, Sharon Edwards, and Lorraine Cole. All right. But I want to read this part that say Black women need their own health model. Like most modern day families, African American families are smaller and more isolated than those of their ancestors. We have lost our well known tradition of the extended family through which health and self care information was shared. This isolation has left women with fewer opportunities to talk with others about their lives, so many are left to suffer physical and psychological alignments in silence. They blame themselves for the situation they are in, because believing that it is only happening to them. The conspiracy of silence, compounded by racism, sexism, and classism, contribute to making women feel unworthy and underserving. These feelings of hopelessness and helplessness create an atmosphere of psychological distress, which prevented women from taking care of themselves and their families. That first gathering in 1983 showed me the need for Black women to gather and speak about our pain, emotional and physical with each other. The challenge was to capture the spirit of hopefulness and empowerment and continue the work we started at that conference. We also needed to figure out how to develop our own health perspective, a perspective on health that was uniquely Black and female. We knew that there were certain elements that had to be maintain. The idea of a holistic approach to health is essential. On the basis of our African heritage, African American women respond positively to healthcare that addresses our needs to integrate our feelings and spirituality with health information. This kind of holistic approach allows us to feel whole, look critically at ourselves, unite with each other, and feel powerful and proud. It is also crucial for Black women to come together in a safe place to talk about the issues that have rendered us vulnerable. Breaking the silence of pinpointing our concerns and priorities had to be done within the trusting circles of Black women. She also written, 1 year after the 1983 conference, the Black Women's Health Project became the National Black Women's Health Project. Its mission to develop ways of motivating and empowering Black women to take charge of their health, their families, and their lives. We started to organize self-help groups throughout the country. We opened our hearts, faced our fears, and talked openly about our lives and our health conditions. In the circles, in the presence of others, we cried, laughed, were comfort, and gained strength. We learned that we could develop our own perspectives on our health. We learned that we are powerful and worthy of the best of everything that life has to offer. We gave birth to ourselves in the midst of and with the help of each other. This message was communicated throughout all of the work of the National Black Women's Health Project, but it was clearly demonstrated by women who recounted the ways in which their lives were changed. By taking charge of their lives, they were making changes in all segments of their lives and their families. African American women started to claim their personal power, which translated into women who were living their lives in more authentic ways. All right, so that's this information. It comes from, I'm trying to think, it comes from the American Journal of Public Health on April 2002, volume 92, number 4. All right. So it was peer reviewed. And again, it was written by Byllye Avery, and this is Byllye Avery right here. All right. So this is her in the middle. Okay. All right. So with that being said, that's all I have for tonight. That's the information about the National Black Women, the National Black Women's Health Project and Miss Byllye Avery. So I will be doing more information, continuously presenting more stuff about African American history, Africans throughout the diaspora. So that's what I'm going to do. And until next time, please take it easy. Be safe, peace and power elevation. And thank you all for watching. And shout out to the chat. And that's it. All right. All right, then. Now take it easy. Be safe. Peace.